If you have noticed a shadow creeping into the edge of your vision, if you see sudden flashing lights that appear when you move your eyes, or if a dark curtain seems to be slowly closing over part of what you can see, I need you to stop everything and pay close attention to what I am about to share, because these are not signs of normal aging, and waiting could cost you your eyesight or worse. Your peripheral vision is the early warning system of your eyes. When something goes wrong with your retina, your optic nerve, or even your brain, changes in your side vision are often the first signal. The tragedy is that millions of seniors dismiss these warning signs, assuming they are just getting older, until the damage becomes permanent. This is not about needing new glasses. This is not about the minor changes that naturally come with age. This is about recognizing the specific visual symptoms that indicate a medical emergency is happening right now inside your head. Let me make you a clear promise. By the end of this video, you will know exactly which peripheral vision changes require immediate medical attention. You will understand what these symptoms indicate and why speed matters so much. And you will have the knowledge to potentially save your vision or even your life by acting quickly when these warning signs appear. I am Dr. James Mitchell. I have spent over 25 years helping patients protect their health, and few things frustrate me more than seeing someone who lost their vision because they did not know the warning signs. Vision loss from many of these conditions is preventable if caught early, but once the damage is done, it is often permanent. The eyes are unique organs. They are the only place where we can directly observe blood vessels and nerve tissue without surgery. What happens in your eyes often reflects what is happening throughout your body, including in your brain. That is why changes in your vision can signal problems far beyond just your eyes. So let me ask you directly, have you noticed any changes in your peripheral vision recently? Have you seen flashes of light, floating spots, or shadows that were not there before? Write your answer in the comments below, because becoming aware of these changes is the critical first step, and the difference between early treatment and permanent damage can be measured in hours. Let me tell you about a man named Richard. Richard was 71 years old and began noticing something strange in his right eye. It was like a cobweb floating at the edge of his vision. Then he started seeing occasional flashes of light, especially when he moved his eyes quickly in a dark room. Richard assumed it was just his eyes getting older. He had worn glasses for years and figured this was just another annoyance that came with age. He planned to mention it at his next regular eye appointment, which was 3 months away. 2 weeks later, Richard woke up with what he described as a dark curtain covering the lower half of his vision in that eye. By the time he got to an emergency room, the curtain had risen to cover most of his sight. Richard had experienced a retinal detachment. The flashes and floaters were his retina beginning to pull away from the back of his eye. The curtain was the detachment progressing. If he had sought help when the flashes first started, his retina could have been repaired with a simple laser procedure. Instead, he required emergency surgery and still lost significant vision in that eye permanently. Richard tells everyone he meets now about the warning signs he ignored. He says if he had known what those flashes and floaters meant, he would have gone to a doctor that same day. He did not know. And that lack of knowledge changed his life. I share Richard's story because it illustrates exactly why I am making this video. The warning signs were there, they were clear, but Richard did not recognize them as urgent. And that delay made all the difference. Here is what I need you to understand about your peripheral vision and why changes to it are so significant. Your retina is a thin layer of tissue at the back of your eye that converts light into electrical signals your brain interprets as vision. It is fed by tiny blood vessels and connected to your brain through the optic nerve. The peripheral parts of your retina handle your side vision, and they are often the first areas affected when something goes wrong. Your peripheral vision is also processed by specific parts of your brain. When there are problems in those brain regions, peripheral vision changes can be the first symptom. This means that what you see in your side vision can reveal problems with your eyes, your blood vessels, and your brain. As we age, certain changes in vision are normal. Some loss of contrast sensitivity is expected. Needing more light to see clearly is common. Minor floaters that have been present for years are usually harmless. These gradual changes that happen slowly over time are typically not emergencies. But sudden changes are different. New symptoms that appear abruptly or progress rapidly often indicate serious problems that require immediate attention. The key word is sudden. When something changes quickly in your vision, especially your peripheral vision, it is almost never normal aging. Now let me walk you through the specific warning signs that should send you to a doctor immediately. The first warning sign is sudden onset of flashing lights in your peripheral vision. These flashes often look like lightning streaks or camera flashes at the edge of your visual field. They may be more noticeable in dim lighting or when you move your eyes quickly. They typically occur in one eye at a time. These flashes happen when the vitreous gel inside your eye pulls on your retina. The retina has no pain receptors, but it does respond to physical stimulation with light signals. When something tugs on it, you see a flash even though no actual light is present. Some vitreous pulling is normal as we age. The gel shrinks and separates from the retina in most people eventually. But aggressive pulling can cause the retina to tear, and a retinal tear can quickly become a retinal detachment if not treated. If you suddenly start seeing flashing lights that you have never experienced before, this is not something to monitor and mention at your next appointment. This is something to have examined within 24 hours, ideally sooner. An ophthalmologist can examine your retina and determine if it is simply normal vitreous separation or if there is a tear that needs immediate laser treatment. The laser treatment to seal a retinal tear takes minutes and is nearly painless. It prevents the tear from becoming a detachment, but it only works if the tear is caught before full detachment occurs. Once the retina detaches, much more serious surgery is required and outcomes are far less certain. Let me tell you about a patient named Eleanor. She was 68 years old and noticed flashing lights in her left eye one evening. Her husband told her it was probably nothing, but Eleanor had heard somewhere that flashes could be serious. She called her eye doctor first thing the next morning. Her ophthalmologist examined her and found a small retinal tear at the edge of her retina. That same day, she had laser treatment to seal the tear. The procedure took about 10 minutes. Eleanor went home and resumed normal activities within a day. Her vision was completely preserved. Eleanor's outcome was entirely different from Richard's, even though they had the same initial symptom. The difference was timing. Eleanor acted immediately. Richard waited. That distinction determined whether they kept their vision or lost it. The second warning sign is a sudden increase in floaters, especially if accompanied by flashes. Floaters are small spots, strings or cobweb shapes that drift across your vision. Most adults have some floaters, especially after middle age, and these are usually harmless shadows cast by clumps of protein in the vitreous gel. But a sudden shower of new floaters, particularly if they appear like a swarm of gnats or a cloud of pepper flakes, can indicate that your retina is bleeding or tearing. When the vitreous pulls hard enough to damage the retina, it releases blood or pigment cells into the gel. These appear as a sudden increase in floaters. The combination of new flashes and a sudden increase in floaters is particularly concerning. This pattern often indicates active retinal damage and should be evaluated urgently. I want to be clear about the difference between concerning floaters and normal ones. A few floaters that have been present for years and do not change are usually benign. A sudden appearance of many new floaters, especially with flashes, is a warning sign. The key is whether there has been a sudden change from your normal baseline. The third warning sign is the most urgent of all. If you see a dark shadow or curtain moving across your peripheral vision, especially if it is progressing over hours or days, this may indicate a retinal detachment already in progress. When the retina detaches from the back of the eye, it stops receiving oxygen and nutrients from the underlying tissue. The cells begin to die quickly. Vision in the affected area goes dark because those retinal cells are no longer functioning. A detaching retina typically starts at the periphery and progresses toward the center. You might first notice a shadow in your far side vision. Over hours, that shadow may grow larger, moving toward your central vision. It is often described as a curtain closing or a dark veil descending. This is an emergency. Every hour matters. The sooner surgery can reattach the retina, the more vision can be preserved. Delays of even a day or two can mean the difference between recovering most of your sight and being left with permanent significant vision loss. If you experience a shadow or curtain progressing across your vision, do not wait until morning. Do not wait for a regular appointment. Go to an emergency room or call your ophthalmologist's emergency line immediately. This is one of the few true emergencies in eye care. Let me tell you about a woman named Dorothy. Dorothy was 74 years old and noticed a small shadow in the corner of her right eye late one afternoon. She thought perhaps she was just tired and went to bed early. When Dorothy woke the next morning, the shadow had grown to cover nearly a quarter of her vision in that eye. She called her daughter, who insisted on driving her to the emergency room immediately. Dorothy was diagnosed with a retinal detachment and had surgery that same day. Because she acted relatively quickly, her surgeon was able to reattach her retina before the detachment reached her central vision. Dorothy recovered most of her sight in that eye, although there is some residual loss in her peripheral field. If Dorothy had waited another day, if she had assumed it would go away on its own, the detachment would likely have reached her macula, the center of her vision. Once the macula detaches, the chances of recovering good central vision drop dramatically. The fourth warning sign involves gradual loss of peripheral vision that you may not even notice. This is the insidious nature of glaucoma, often called the silent thief of sight. Glaucoma damages the optic nerve, typically starting with peripheral vision loss that progresses so slowly that many people do not realize they are losing sight. This is different from the acute symptoms I described earlier. Glaucoma usually does not cause flashes or sudden floaters. Instead, it quietly steals side vision over months and years. You may not notice because your brain compensates and fills in the missing areas. You may only realize something is wrong when the damage is already severe. However, there are subtle signs that your peripheral vision may be declining. You may find yourself bumping into door frames or furniture more often. You may have difficulty noticing cars in adjacent lanes when driving. You may startle when people seem to appear suddenly at your side because you did not see them approach. If you have noticed any of these patterns, particularly if you are over 60, have a family history of glaucoma, or are of African or Hispanic descent, you need a comprehensive eye examination that includes optic nerve evaluation and peripheral vision testing. Unlike retinal detachment, which is an emergency, glaucoma is a condition that develops over time and is managed with ongoing treatment. But the damage it causes is irreversible. Vision lost to glaucoma does not come back. The goal of treatment is to prevent further loss. That is why early detection matters so much. The fifth warning sign extends beyond the eyes themselves and into the brain. Sudden changes in peripheral vision can sometimes indicate stroke or transient ischemic attack, particularly when the changes affect both eyes in the same way. The visual processing centers of your brain are located in the back of your head, in the occipital lobe. Blood supply to these areas comes through the vertebral and basilar arteries. When blood flow to these regions is disrupted, vision changes are often the first symptom. A pattern called homonymous hemianopia involves losing the same side of vision in both eyes. For example, you might lose the right half of your visual field in both your left and right eye. This happens because the brain processes the right visual field in the left side of the brain and vice versa. If you suddenly cannot see things on one side, and this affects both eyes, this is a neurological emergency. It may indicate a stroke affecting the visual cortex. Other symptoms of stroke, such as weakness on one side of the body, difficulty speaking, or severe headache may or may not be present. There is another visual phenomenon that can precede stroke, called amaurosis fugax. This is temporary vision loss in one eye, often described as a shade being pulled down over vision and then lifted again after several minutes. It is caused by temporary blockage of blood flow to the retina and is a major warning sign that a stroke may follow. If you experience sudden vision changes that affect both eyes in the same pattern, or temporary complete vision loss in one eye, treat this as a potential stroke and seek emergency care immediately. The same is true if vision changes are accompanied by any other stroke symptoms. Let me tell you about a man named Walter. Walter was 76 years old and was reading his newspaper when he realized he could not see the right side of the page. He closed one eye, then the other, and discovered that the right side of his vision was missing in both eyes. Walter's wife immediately recognized this as abnormal and called emergency services. In the emergency room, a CT scan revealed Walter had experienced a small stroke in the left side of his visual cortex. He was treated with blood thinners and other stroke interventions. Walter's quick action meant the stroke was treated before additional brain damage occurred. His vision partially recovered over the following months with rehabilitation. If he had waited, assuming it was just an eye problem that would resolve, the stroke could have progressed and caused far more extensive damage. Now I want to explain why seniors are particularly vulnerable to these conditions and why awareness is so critical. After age 60, the risk of retinal detachment increases significantly. The vitreous gel that fills the eye becomes more liquid with age and is more likely to pull away from the retina and potentially cause tears. People who are nearsighted, who have had eye surgery, or who have had eye injuries are at even higher risk. Glaucoma risk also increases dramatically with age. By age 80, a significant percentage of the population has some degree of glaucoma, yet many people do not know they have it until substantial vision has already been lost. Stroke risk rises with age as well. The blood vessels supplying the brain and eyes become more susceptible to blockage and damage. Conditions like high blood pressure, diabetes, and heart disease that are more common in seniors further increase stroke risk. All of this means that seniors are exactly the population most likely to experience serious causes of peripheral vision changes. And sadly, seniors are also the group most likely to dismiss these changes as just getting older. Let me give you clear guidance on when to seek immediate medical attention. You should treat the situation as urgent and seek care within hours if you experience a sudden shadow or curtain moving across your vision that was not there before, if you have sudden loss of a section of your peripheral vision, if you see a dramatic sudden increase in floaters, especially with flashing lights, or if you have complete temporary vision loss in one eye even if it resolves. You should seek care within 24 hours if you notice new flashing lights in your peripheral vision, even without other symptoms. If you have a moderate increase in floaters that is noticeably different from your normal baseline. You should schedule a comprehensive eye examination promptly if you notice you have been bumping into things more often, if others seem to appear suddenly at your side without you noticing their approach, if you have difficulty seeing cars in adjacent lanes while driving, or if it has been more than a year since your last thorough eye examination, including peripheral vision testing. I also want to emphasize something about the importance of regular comprehensive eye exams for seniors. Many conditions that affect peripheral vision can be detected before symptoms become obvious. Glaucoma can be identified by examining the optic nerve and testing peripheral vision before significant damage occurs. Retinal problems can sometimes be spotted during routine examination when they are still treatable with minimal intervention. Everyone over 60 should have a comprehensive dilated eye examination at least every 1 to 2 years. This is not the same as a simple glasses prescription check. It includes dilation of the pupils, examination of the retina and optic nerve, and often peripheral vision testing. These examinations can catch problems early when treatment is most effective. If you have risk factors such as diabetes, high blood pressure, family history of glaucoma, or previous eye problems, you may need more frequent examinations. Discuss the appropriate schedule with your eye care provider. Let me share one more story because it illustrates the power of paying attention and acting quickly. A woman named Helen was 72 years old and noticed something strange happening in her vision. She saw a bright flash followed by what looked like a small dark spot in the corner of her right eye. Having seen a video similar to this one, Helen recognized these as potential warning signs and called her ophthalmologist immediately. Her doctor examined her that afternoon and found a small retinal tear. Helen had laser treatment the same day to seal the tear. The entire experience from first symptom to completed treatment took less than 8 hours. Helen told me that if she had not known what those symptoms meant, she would have assumed it was nothing and waited. She might have become another story like Richard's, losing significant vision because she did not understand the urgency. Instead, her vision is perfectly preserved because she had the knowledge to act immediately. This is exactly why I am sharing this information. Knowledge saves vision. Knowledge saves lives. What you learn in videos like this one can make the difference between early intervention and permanent damage. Here is what I want you to remember from this video. Sudden changes in peripheral vision are almost never normal aging. Flashing lights, sudden increase in floaters, shadows or curtains across vision, and sudden loss of side vision are all warning signs that require prompt medical attention. Retinal detachment is an emergency that progresses over hours to days. The sooner it is treated, the more vision can be saved. Glaucoma steals peripheral vision silently over years and requires regular screening to detect early. Vision changes affecting both eyes in the same pattern may indicate stroke and require emergency evaluation. Your peripheral vision is trying to tell you when something is wrong. Please listen to it. If you have experienced any of the symptoms I described, or if it has been more than a year since your last comprehensive eye examination, please take action. Make that appointment. Get your eyes checked. Do not dismiss changes as just getting older. The seniors who keep their vision are the ones who take warning signs seriously and act quickly. You can be one of them. If this information was valuable to you, please share it with the seniors in your life. Share it with your parents, your spouse, your siblings, your friends. The more people who recognize these warning signs, the more vision can be saved. And if you want more information about protecting your health as you age, subscribe to this channel. I have much more to share with you. Thank you for watching. This is Dr. James Mitchell. Take care of your eyes because they are your window to the world.